I'm Kathy Payne, your host for this interactive video disc training program on how to prevent on-the-job exposure to the AIDS virus. This course will provide facts about AIDS and specific precautions you need to take on your job. You'll meet key healthcare authorities and professionals who are experts on AIDS. They'll share their experiences and knowledge so that when you've completed the course, you will know what AIDS is, how the AIDS virus is transmitted, what your risk of exposure to the virus is and what we know about transmission, and what precautions to use on the job. This course has been developed for interactive video disc, a new technology which combines the communication power of television with the interactivity of computers. For some of you, this may be a new experience. Interactive video disc lets you set the pace. You control the amount of time you spend in a particular topic area and the order in which you view the program. In addition to the video disc, there's a handbook which contains information about the topic. The handbook will be updated periodically to include new information. This program is designed to teach you procedures to use when coming in contact with blood and body fluids. In this course, we will use the term blood and body fluids. For the most current definition of those body fluids which are known to transmit the virus, please consult the latest edition of the course handbook. The practices you will see are not new. They are standard infection control practices. What you will learn new in this course is why it is necessary to use them when coming in contact with blood and body fluids from all patients. You may choose the sections of the program you'd like to study. In each section, experts will discuss topics related to prevention of occupational exposure to the AIDS virus. Then, you'll have a chance to summarize the material covered and practice what you've learned. There's also a test you can take when you've completed all the topic areas. There are 5 sections in this program. The introduction provides general information on the AIDS epidemic and features Dr. James Curran, Director of the AIDS Program at the Centers for Disease Control. Facts about AIDS includes what causes the disease, how it's transmitted, and why precautions are necessary. Protective attire describes barriers used to prevent or reduce exposure to blood or body fluids. Job procedures include safeguards used to prevent exposure to blood and body fluids. And environmental procedures outlines proper cleaning, disinfection, and sterilization. Choose the topic you'd like to cover first, but be sure to cover all the topics. If this is the first time you're using the program, it's best to start with introduction. Choose the topic you'd like to cover first, but be sure to cover all the topics. If this is the first time you're using the program, it's best to start with introduction. To begin, let's meet one of the country's leading AIDS experts, Dr. James Curran, at the Centers for Disease Control. Dr. Curran has been involved with the AIDS epidemic since its beginning and will address fears and facts about transmission of the virus and how the methods of transmission are known by scientists.
AIDS is a major health care problem throughout the world, and it's increasing in the United States. More and more, it's a problem that all of us as healthcare workers must deal with. AIDS is a fatal disease. There is as yet no vaccine or definite cure for the AIDS virus. As such, we must learn to deal with this disease. We can be encouraged, however, because it is entirely preventable. No one need become infected with the AIDS virus. Studies throughout the world have demonstrated that the AIDS virus is primarily transmitted through sexual contact or through parenteral exposure to blood or blood-containing body fluids. Another important means of transmission is from an infected mother to her newborn. What is the risk to healthcare workers? As with all others, the greatest risk will be through sexual contact. Over 90% of healthcare workers with AIDS throughout the world have acquired their infections through sexual contact or IV drug abuse. There is a very small but real risk of acquiring the AIDS virus through parenteral exposures to blood or other body fluids containing blood. But these can be minimized greatly by taking universal precautions when exposure to these fluids are necessary. Now, after over 4 years of prospective studies of over 2,000 healthcare workers, it's quite clear that the risk through a needle stick is less than 0.5%. Less than 1 in 200 who have a needle stick from a patient with AIDS will actually become infected with the virus. The risk is much lower for blood exposure on the hands or skin. Over 2,000 healthcare workers at the National Institute of Health have had blood from AIDS patients spilled on their hands or skin without demonstrating evidence of the virus and over 6 months follow-up. Additionally, studies throughout the world of household members, people who have lived in the family unit on a daily basis and shared meals, and shared bathrooms, shared household utensils with people with AIDS, have failed to show any transmission through casual contact in this setting. So what is our role as healthcare professionals? First of all, we should know the precautions that should be taken to avoid transmission to ourselves in the workplace. We should teach others those precautions, and we should abide by them. Practice them well, practice them faithfully. Second of all, we should know the facts about AIDS. We should not be unnecessarily afraid of AIDS patients or colleagues who are infected with the virus. We must know the facts so that we can do our duty as healthcare workers to our patients and to our friends.
We know that healthcare workers are concerned about on-the-job exposure to the AIDS virus, and justifiably so. But by learning the facts about occupational exposure from Dr. Curran, fortunately, we can see the actual risk has been very low and can be prevented or reduced by following the precautions outlined in this course. There are some things we don't understand about acquired immune deficiency syndrome, or AIDS, but we do know what causes it, how it affects the body, how it is spread, how it is not spread, and most important of all, how we can prevent on-the-job exposure. In this section, Dr. Carl Perlino, an infectious disease specialist and expert in AIDS, will share with us important facts about the virus and the disease.
I'm a specialist in infectious disease, and the specialty of infectious disease has found its responsibility to care for patients with AIDS because they have so many infections, and AIDS itself is an infection. I also have been medical director of the AIDS clinic at Grady Memorial Hospital in Atlanta, and at the present time I am the hospital epidemiologist at Grady and have considerable experience with putting together policies and implementing policies to protect the healthcare worker from potential infection with HIV.
Choose one of the following topics you'd like to cover or return to the course menu. We recommend that you review each of the topics.
AIDS is caused by a virus, the human immunodeficiency virus, or HIV. Viruses are microorganisms which invade and infect cells. An invading virus multiplies within an infected cell, causing the cell to die. The virus then continues to multiply and infect more cells, causing infection and disease.
HIV's primary target is the immune system's special white blood cells called T4 helper cells. These T4 cells play a central role in the body's fight against infection. When HIV enters the bloodstream, the virus seeks out and fuses with the T4 cells. The virus acts like a tiny syringe, injecting its own genetic material into the cell. Once inside, the virus rearranges the genetic code of the T4 cell, directing the cell to make copies of the virus. Gradually, this new viral matter pushes through the surface of the host cell, creating a bud which attracts and locks up with other T4 cells. Eventually, the host cell dies. This process continues, destroying the body's ability to fight infection. The body becomes vulnerable to opportunistic illnesses that take advantage of the lowered resistance. When a virus invades our body, our system responds by producing antibodies. Normally, we have antibodies for each infectious disease that we have been infected by, such as rubella, the German measles. Once these antibodies are present, we're then immune to further infection from that disease. For reasons not clear, the HIV antibody is not protective in this way. HIV antibodies in a person indicate that person has been infected with the AIDS virus. It does not indicate protection from developing AIDS. Dr. Perlino, once a person is infected with HIV, how soon will it be before AIDS develops?
The first thing that happens is that the patient will develop antibodies to the virus. That usually occurs within 3 months. The next thing that occurs is the patient will go through a period of time with no symptoms of disease. That's a variable period of time. The majority of people who are infected will, during a several-year period, develop some symptoms, not necessarily AIDS, but of varying numbers of symptoms. They can be weight loss, chronic fevers. After several years, the majority of patients will develop true AIDS.
One way to understand the spectrum of HIV infection and disease is through the use of a pyramid. HIV-infected persons without symptoms are represented at the bottom. These people do not show any signs of the disease, and many don't know they're infected, yet they are infectious and can spread the disease to others. A majority of the people infected with HIV fall into this category. Moving up the pyramid, there are persons with illnesses related to HIV infection. These people are not classified by the CDC as having AIDS and are not represented in reported numbers of AIDS cases. Some of their symptoms include weight loss, fever, night sweats, diarrhea, fatigue, and swollen lymph nodes. There are estimated to be 10 times as many people with illness related to HIV infection than there are people with AIDS. Here at the top of the pyramid are persons with AIDS. According to the Centers for Disease Control case definition, at least one of the following 4 manifestations must be present and documented to be identified as a case of AIDS: opportunistic infections, opportunistic diseases, HIV dementia, or HIV wasting syndrome.
The 4 manifestations of AIDS primarily include, number 1, opportunistic infections. The most common opportunistic infection is pneumocystis pneumonia. Opportunistic infections are essentially those that occur in people that have severe defects in their immune system, so that they cannot control normal infections that we all might get. And with a normal immune system, we don't have problems with these diseases. Secondly, there's opportunistic diseases. They're primarily tumors. Kaposi sarcoma lymphomas occur in patients with AIDS. In the third instance, there's chronic dementia. Dementia usually occurs in older people. What we're seeing in patients with AIDS, younger people lose their mental capacities, lose their capacity to care for their own bodily function. Fourthly, there's the wasting syndrome. And the wasting syndrome is weight loss, chronic diarrhea, fevers perhaps, with no other obvious cause of those symptoms.
Right. You cannot tell if a person is infected by looking at them. No, you cannot tell by looking at a person if he or she is infected. Many people who are infected show no sign of disease for a number of years. There are a lot of misconceptions about how the AIDS virus is spread. In this section, we'll learn to describe how the virus is and is not transmitted. You can't get the AIDS virus from casual contact. You can't get the AIDS virus by hugging, holding, or touching. The virus is not transmitted by mosquitoes or other insects or through the air. The AIDS virus is not spread in swimming pools or by sharing eating utensils, food, or work equipment. Now, let's take a look at how the AIDS virus is spread.
The major method of spread of the AIDS virus is through sexual contact, intercourse, with somebody who has been infected with the virus. Other methods are through perinatal exposure. A mother infected with the virus may transmit the virus to the infant during pregnancy or during birth. The major concern we have here is with parenteral exposure. Infected IV drug users sharing needles with non-infected IV drug users. The patient may receive transfusions from an infected individual receiving infected blood or other blood products. An occupational exposure may potentially occur. For example, needle stick or puncture injuries with sharp instruments.
Please define exposure for us.
Exposure simply means having contact with the virus or a body fluid that has the virus in it, without necessarily becoming infected with the virus.
What types of occupational exposure are there?
There are three major types of exposures that we are concerned about. One would be parenteral exposures, next would be mucous membrane exposures, the third would be prolonged cutaneous or skin exposure.
Could you go in a little more detail about each of those?
The parenteral exposures primarily are needle sticks or sticks with a sharp object. By that we mean that the potential that's there for transmission of the virus through the skin by a sharp object that is contaminated with the virus. A lot of healthcare workers will have needle stick exposure. We all know that by experience. What we do know also from a number of different studies is that the risk of transmission of HIV through this method is very uncommon. Less than 1% of healthcare workers who have received needle sticks from infected patients have had infection with the virus. Mucous membrane exposure would be exposure of blood or other body fluids by splashes in the eyes, mouth, nasal passages. Ones that are potential, but again, do not occur that commonly. The skin exposure is a potential concern in that a person may have prolonged contact with blood or body fluids on their skin. The skin is a normal host defense mechanism, very good at keeping infectious agents out. Occasionally you will have cracks or small cuts in the skin that will allow viruses to transmit the normal barrier.
That's right. The virus can be spread by parenteral exposure, such as the needle stick in this picture. It is not spread by touching skin that is intact. No, the virus can be spread by parenteral exposure, such as a needle stick, but cannot be spread by touching skin that is intact.
Precautions are necessary because we don't have the ability to identify with certainty all patients who may be infected with the AIDS virus. So we have to treat all the patients the same. The majority of infected persons are asymptomatic and may not realize they're infected and can infect others. Physical exams can't detect these individuals. And although there is a test that can determine whether somebody is infected with the AIDS virus, no test is 100% sensitive nor specific. Even though you can't always know when a patient is infected with the AIDS virus, you can prevent or reduce your potential exposure on the job by following universal blood and body fluid precautions with all patients, regardless if they are known to be infected.
What are some other benefits of following precautions?
The other benefits for following precautions is that will protect the healthcare worker against infection with other viruses, notably the hepatitis B virus, which is transmitted much the same way as HIV, and also cytomegalovirus. Following precautions would hopefully prevent transmission in a healthcare setting of those viruses.
Dr. Perlino, what about an AIDS vaccine?
An AIDS vaccine would be very important to have. It would be very nice for us to have. However, one is not available at the present time. Characteristics of the AIDS virus will make it very difficult to have a vaccine available in the near future. So what we have to do in the meantime is use other methods to protect us from getting infection with the AIDS virus.
That's right. The nurse should use precautions when coming into contact with blood and body fluids to prevent or reduce exposure to both HIV and HBV. That's partially right. Precautions should be used when coming into contact with blood and body fluids of all patients to reduce or prevent exposure to HIV and HBV. Hello, I'm Kathy Payne, your host for this interactive video disc training program on how to prevent on-the-job exposure to the AIDS virus. This course will provide facts about AIDS and specific precautions you need to take on your job. You'll meet key healthcare authorities and professionals who are experts on AIDS.
AIDS is a major healthcare problem throughout the world, and it's increasing in the United States. More and more, it's a problem that all of us as healthcare workers must deal with. AIDS is a fatal disease. There is as yet no vaccine or definite cure for the AIDS virus. As such, we must learn to deal with this disease. We can be encouraged, however, because it is entirely preventable. No one need become infected with the AIDS virus.
You may choose the sections of the program you'd like to study. In each section, experts will discuss topics related to prevention of occupational exposure to the AIDS virus. Then, you'll have a chance to summarize the material covered and practice what you've learned. There's also a test you can take when you've completed all the topic areas. There are 5 sections in this program. The introduction provides general information on the AIDS epidemic and features Dr. James Curran, Director of the AIDS Program at the Centers for Disease Control. Facts about AIDS includes what causes the disease, how it's transmitted, and why precautions are necessary. Protective attire describes barriers used to prevent or reduce exposure to blood or body fluids. Job procedures include safeguards used to prevent exposure to blood and body fluids. And environmental procedures outlines proper cleaning, disinfection, and sterilization. HIV's primary target is the immune system's special white blood cells called T4 helper cells. These T4 cells play a central role in the body's fight against infection. When HIV enters the bloodstream, the virus seeks out and fuses with the T4 cells. The virus acts like a tiny syringe, injecting its own genetic material into the cell. Once inside, the virus rearranges the genetic code of the T4 cell, directing the cell to make copies of the virus.
The major method of spread of the AIDS virus is through sexual contact, intercourse, with somebody who has been infected with the virus. Secondly, the spread of the virus may occur by perinatal exposure. An infected mother may transmit the virus to an infant during pregnancy or birth. Thirdly, parental exposure may occur.
When you use a vacutainer to draw blood, how do you dispose of the needle?
Well, like a needle and syringe, vacutainers also need to be handled with extreme care. Once a venipuncture has been completed, don't recap the needle. Special puncture-resistant containers are available specifically for the vacutainers. These containers also allow safe removal of the needle. After the vacutainer needle has been removed, the holder can be reused. If the vacutainer needle is not removed in this way, the needle and holder should be disposed of intact in a puncture-resistant container.
Yes, in order to prevent getting a needle stick, the nurse should dispose of the needle without recapping or breaking it. No, In order to prevent getting a needle stick, the nurse should dispose of the needle without recapping or breaking it. Where should the needle and syringe be disposed? You're right. Disposable needles and syringes should be placed intact into a puncture-resistant container. No, disposable needles and syringes should be placed intact in puncture-resistant containers to reduce the risk of accidental needle sticks. Yes, the AIDS virus is spread by sharing IV drug needles. The AIDS virus is not spread by hugging or sharing eating utensils. In this section of our course, we'll show you how you can prevent or reduce your potential exposure to the AIDS virus and other bloodborne viruses by correctly wearing gloves, masks, and gowns. Such protective attire serves as a barrier between you and infectious blood and body fluids. Let's meet Edna Killam of St. Joseph's Hospital and find out how to protect yourself with specific attire.
It's necessary to wear the protective attire for many reasons. First of all, healthcare workers tend to be somewhat fearful as they provide care to AIDS patients. By understanding the need for wearing protective attire, they relieve themselves of the fear that they have. These precautionary measures are not new. They are ones that we have used, especially with hepatitis B.
So you're not treating AIDS patients any differently?
Exactly. We don't want to treat the AIDS patient any differently. We want to incorporate these precautions as a routine part of all patient care. And we hope that in this practice, they will recognize the importance of using these barriers.
How much time does it really take to put on this protective attire?
It doesn't take an awful lot of time. This can be done very quickly, and indeed, the little time that it does take, it's well worth it.
Choose one of the following topics you'd like to cover, or return to the course menu. We recommend that you review each of the topics.
Gloves should be worn whenever you're going to have contact with blood or body fluids, with non-intact skin and mucous membranes. Additionally, when you're going to have contact with the items that are soiled with blood or body fluids, you should wear your gloves. There are certain procedures also, such as vascular access procedures, in which you would also want to wear gloves.
Well, when should gloves be removed?
Gloves should be removed after patient care is completed. Then hand washing should follow. There are oftentimes procedures which do not require the use of gloves at all, certain routine patient care contact.
What happens if a tear occurs in a glove that you happen to be wearing?
If a tear occurs in your glove, then you should remove it as soon as possible. Then wash your hands and apply a new glove. If you have an open draining lesion or weeping dermatitis, you should not participate in patient care, nor should you handle equipment until this situation has cleared.
Yes, the nurse should wear gloves when coming into contact with blood and body fluids, but gloves are not necessary when touching skin that is intact. No, it is not necessary to wear gloves when touching intact skin of patients, but the nurse should wear gloves when coming in contact with blood or body fluids, mucous membranes, or non-intact skin.
Masks, protective eyewear, or face shields should be worn to prevent mucous membrane exposure of blood or body fluids to the eye, nose, or mouth.
Regardless if the patient is known to be infected or not, When there is the possibility of splashes or droplets of blood or body fluids, you need to wear a mask, protective eyewear, or a face shield. Correct. The dental hygienist should wear a face shield, as she may encounter splashes or droplets of body fluids. Incorrect. Face shields or masks are needed only when splashes or droplets occur. This is unlikely during a routine patient examination.
Sometimes contact with a patient may require additional protection. This may mean wearing a gown or apron to prevent your clothing from becoming soiled with blood or body fluids. You should wear a gown or apron when splashes of blood or body fluids are likely. You should change your gown or apron when soiled with blood or body fluids, or at least daily.
Which of these types of protective attire should a healthcare worker use when drawing blood? Yes, gloves are the only protective attire needed in this situation. Masks and gowns are worn only when droplets or splashes of blood and body fluids are likely. No, gloves are the only protective attire needed in this situation. Masks and gowns aren't necessary when drawing blood. Masks and gowns are used when splashes or droplets of blood and body fluids are likely. This section of our program is about job procedures and how to avoid possible exposure to the AIDS virus when working with needles, blood, or body fluids. It also addresses some of the concerns people have about performing resuscitation. Let's meet Jerry Bryant of the Cleveland Clinic Foundation and find out about work procedures that protect you from exposure to the AIDS virus.
Precautions should be followed when working with any blood or body substance. This will prevent not only infection with HIV, but also with other bloodborne diseases such as hepatitis B, which is really much more infectious than HIV. These precautions are very simple and can be implemented in any healthcare setting.
Choose one of the following topics you'd like to cover, or return to the course menu. We recommend that you review each of the topics.
Sharp instruments need to be handled with extraordinary care during use and disposal to prevent needle stick and other puncture injuries. Needle sticks and punctures with other sharp instruments are the primary ways healthcare workers become exposed to the AIDS virus. You can prevent or reduce your risk of this type of exposure by following recommended guidelines every time you use and dispose of a needle and syringe or sharp instrument. First of all, take extreme care not to accidentally stick yourself while using a needle and syringe. After you are finished using it, carefully place the used needle or syringe intact in a puncture-resistant disposal container. Do not recap, break, remove, or manipulate in any way the needle and syringe before you dispose of it. When you are disposing needles and syringes and other sharp instruments, always use a puncture-resistant container and be sure to keep the container close to the area in which it will be used. Some commercially available containers include a needle cutting device. If yours does, don't use the device. It can result in blood splatters.
When you use a vacutainer to draw blood, how do you dispose of the needle?
Well, like a needle and syringe, vacutaners also need to be handled with extreme care. Once a venipuncture has been completed, don't recap the needle. Special puncture-resistant containers are available specifically for the vacutaners. These containers also allow safe removal of the needle. After the vacutainer needle has been removed, the holder can be reused. If the vacutainer needle is not removed in this way, the needle and holder should be disposed of intact in a puncture-resistant container.
Yes, in order to prevent getting a needle stick, the nurse should dispose of the needle without recapping or breaking it. No, in order to prevent getting a needle stick, the nurse should dispose of the needle without recapping or breaking it. Where should the needle and syringe be disposed? You're right. Disposable needles and syringes should be placed intact into a puncture-resistant container. No, disposable needles and syringes should be placed intact in puncture-resistant containers to reduce the risk of accidental needle sticks.
Healthcare workers should wash their hands because hand washing is the most effective way to prevent transmission of infection to themselves and to our patients. The vigorous rubbing and friction with soap will actually remove, inhibit, or kill microorganisms.
When are the proper times to wash hands?
You should wash your hands immediately and thoroughly if they become contaminated with blood or body fluids. You should also wash your hands before performing procedures on patients, after removing your gown and gloves, and after the completion of work. For routine activities, hand washing with plain soap and water is sufficient. Lather your hands with soap and water the facility regularly uses. Vigorously rub your hands together for at least 10 seconds and then rinse them under a stream of water and dry.
Yes. Before leaving, the nurse should remove her gown and gloves and wash her hands. Before leaving the room, the nurse should both remove her gown and gloves and wash her hands.
Care should be taken when handling specimens of blood or body fluids because improper handling can result in spillage and leakage and may result in contamination with blood or body fluid. When you're handling blood or body fluid specimens, be sure to wear gloves. To prevent leakage and contamination during transportation, place specimens in a well-constructed, leak-proof container with a secure lid. Once you've finished placing a specimen in a container, you should carefully examine the outside of the container for leaks or cracks. If a defect in the container is found, place the container in a leak-proof bag before you transport the specimen. After you've completed your specimen processing, don't forget to remove your gloves and wash your hands thoroughly.
Are there special precautions laboratory workers can take to prevent exposure to blood and body fluids?
To prevent exposure to blood and body fluids, laboratory workers should use mechanical pipetting to pipette liquids. Don't use mouth pipetting. It can result in an accidental blood or body fluid exposure to the mucous membranes of your mouth.
Yes, gloves should be worn when handling blood and body fluids. No, gloves should be worn when handling blood. A mask is not necessary.
Resuscitation equipment provides a barrier to prevent direct contact with mucous membranes.
When should resuscitation equipment be used?
Whenever the need for resuscitation is predictable, resuscitation equipment should be available. To avoid direct contact with mucous membranes and oral secretions of the mouth, keep ventilation bags, mouthpieces, and other resuscitation equipment available for use when predictable.
Yes, resuscitation equipment should be available when the need for resuscitation is predictable. No, mouthpieces, ventilation bags, and other resuscitation equipment should be available when the need for resuscitation is predictable. In this section of our program, we're going to discuss how to clean spills of blood and other body fluids, how to disinfect instruments and devices, how to handle soiled linens, how to identify potentially infective waste, and how to clean environmental surfaces. Our expert for this section will be Dr. Martin Favero of the Centers for Disease Control, who will discuss the risk of exposure to the AIDS virus in the environment.
HIV is not transmitted environmentally for two reasons. The virus does not exist in high numbers in blood, but the highest it gets is to about 100 infectious virus particles per cc of blood. Secondly, it's a relatively fragile virus, in contrast to the hepatitis B virus, in which there is an environmental route of transmission. Hepatitis B virus exists in very high concentration, 1 billion per cc, and it's relatively stable and resistant.
Choose one of the following topics you'd like to cover, or return to the course menu. We recommend that you review each of the topics.
Blood spills in hospitals are cleaned up using either a hospital-grade chemical germicide or ordinary household bleach that's diluted 1 to 10 or 1 to 100, depending on the amount of organic load. The bleach solution is inexpensive, easy to use. It has the disadvantage, however, on some surfaces of being corrosive.
What are the steps to follow when cleaning a spill?
When cleaning a spill, staff members should wear gloves. After putting gloves on, the spill area is cleaned, visible organic material is removed, and the area is disinfected with a chemical germicide that is a hospital-grade germicide or freshly prepared bleach solution. The organic material should be cleaned up rapidly before disinfection, or the disinfectant won't work properly.
What about spills in a laboratory?
Spills in a laboratory of microorganisms, bacteria, viruses, are handled in a very conservative manner. The spill area is flooded with a chemical germicide. The spill is then cleaned with toweling or other material. That is disposed of, and throughout this procedure, the staff member wears gloves.
Yes, she should first clean the debris and then disinfect the area. No, first wipe the debris, then disinfect the area.
The AIDS virus is a relatively fragile virus, and the standard array of disinfection and sterilization procedures used in hospitals are adequate. The choice between disinfection and sterilization depends on the intended use of the medical equipment. Patient care devices or instruments through which blood flows or that enter sterile tissue or a patient's vascular system should be sterilized before reuse. On the other hand, devices or items that come into contact with intact mucous membranes should either be sterilized or receive high-level disinfection. Equipment that does not come into contact with mucous membranes or non-intact skin can be disinfected with low to intermediate disinfectants. A hospital disinfectant rather than household bleach should be used on medical devices. Commercially available germicides are especially formulated to be compatible with medical devices, whereas household bleach quite often corrodes these items.
What are the necessary steps to prepare equipment for disinfection?
There are several steps for this purpose. The staff member would wear gloves. The equipment to be disinfected is initially cleaned to remove organic material. This allows the germicide to work better. And then the device is exposed to the chemical germicide that's commonly used in the hospital for that purpose.
That's right. The bronchoscope should be cleaned and then sterilized. The bronchoscope should be cleaned and then sterilized. It does not have to be discarded.
There's no laboratory, epidemiologic, or microbiologic evidence that waste from hospitals is of any more of a hazard to the public than ordinary community waste. Hospital wastes for which special precautions appear to be prudent would include microbiology waste, that is cultures from the laboratory, pathological wastes, blood and blood products, and finally, one must adhere to the specialized policies of a hospital regarding infective waste, which would probably be affected significantly by the local community.
Yes, blood is potentially infectious. No, blood is potentially infectious, not food.
Surfaces such as floors, walls, and so forth are cleaned in a conventional manner using soap and water or detergent germicides. It should be kept in mind that diseases are not transmitted from these types of surfaces.
What types of protective attire should be worn when cleaning environmental surfaces?
It would probably be prudent to have gloves available so that the person could wear gloves.
Are there any special procedures for cleaning rooms occupied by AIDS patients?
The standard housekeeping protocols, disinfection, sterilization protocols for equipment are sufficient for all patients, including AIDS patients.
Yes. Follow routine methods of cleaning surfaces. No. Routine cleaning methods are adequate to clean environmental surfaces.
The transmission of infection by handling linen is very remote. Nonetheless, linens that are soiled with blood or body fluids should be handled by the staff members wearing gloves. Handling the soiled linen as little as possible, place them in sealable, leak-proof bags to prevent leakage during transportation to your facility's laundry area. Soiled laundry can be washed in the standard fashion by the regularly used protocol of the hospital.
Yes. Linen soiled with blood and body fluids should be placed in a leak-proof bag. Linen should be washed in normal washing cycles used by your facility. In this section, you will be able to check what you have learned in the course. Yes, an infected individual can be asymptomatic. Let's review this information. Many infected persons are asymptomatic. Most of them do not know they are infected and infectious to others. That's right. By following blood and body fluid precautions, you can prevent exposure to the AIDS virus and other infections. Let's review this information. By following precautions with all blood and body fluids, you can prevent exposure not only to the AIDS virus, but to other infections. Yes. The AIDS virus is spread by sharing IV drug needles. The AIDS virus is not spread by hugging or sharing eating utensils. Yes, needle sticks and cuts with other sharp objects are the major mode of HIV exposure for healthcare workers. Let's review this information. Occupational exposure to the AIDS virus is parenteral, such as a needle stick or cut with a sharp object, mucous membrane exposure to blood or body fluids, or cutaneous exposure involving large amounts of blood or prolonged contact with blood to open skin. That's right. Exposure does not always result in infection. Let's review this information. Exposure means coming into contact with, but not necessarily being infected by a disease-causing agent, such as the AIDS virus. The incidence of HIV infection due to occupational exposure, such as a needle stick, is less than 1%. Yes, gloves should be worn when handling blood. Let's review this information. Gloves should be worn when touching blood and body fluids, mucous membranes, or non-intact skin. Handling items and surfaces soiled with blood or body fluids, and drawing blood or performing other vascular access procedures. Yes, a face shield should be worn when cleaning a patient's teeth. Let's review this information. To prevent blood or body fluid exposure to the linings of the mouth, nose, and eyes, you should use a face shield during procedures that are likely to result in blood or body fluid droplets or splatters. That's right. Wear a gown or apron when clothing is likely to be soiled with blood. Let's review this information. When your clothing is likely to be soiled with blood or body fluids, you should wear a gown or apron. Yes, used needles and syringes should be placed intact into puncture-resistant containers. Let's review this information. Needles and syringes should be handled with extreme care. You should not recap, cut, bend, break, or otherwise manipulate by hand the needle or syringe before disposal. After use, the needle and syringe should be placed intact into a puncture-resistant container. Yes, when washing hands, vigorous rubbing or friction with plain soap and water will remove, inhibit, or kill most germs, including HIV. Let's review this information. When you are washing your hands, vigorous rubbing and friction with plain soap and water will remove, inhibit, or kill most germs, including HIV. Correct. When processing a specimen, you should wear gloves, use a container with a secure lid, and examine the container for leaks or cracks. Let's review this information. When processing a specimen, wearing gloves, you should carefully place the specimen in a leak-proof container with a secure lid. To prevent leaking and contamination during transport, the container should be examined for leaks and cracks. After processing is completed, you should remove your gloves and wash your hands thoroughly. Correct. Only mechanical pipetting should be used. Let's review this information. You should only use mechanical pipetting. Mouth pipetting can result in exposure of the mucous membranes of the mouth to blood. Correct. The AIDS virus is fragile and easily killed by routinely used disinfectants. Let's review this information. The AIDS virus is fragile and easier to kill than the hepatitis B virus. It is easily killed by routine hospital disinfectants or household bleach. That's right. Visible debris should be removed before disinfecting the spill area. Let's review this information. When you clean a blood spill, you should first remove the visible debris and then disinfect the area with a household bleach solution or hospital disinfectant. If the debris is not removed first, it will interfere with the disinfection process. Correct. Walls and floors do not transmit disease. Let's review this information. Environmental surfaces, such as walls and floors, do not transmit disease. Thank you for participating in our program. These are the people and places who have helped make this program possible.